Module 1. The FMCSA and the Job of Commercial Driving. At this juncture, please make sure that you have already watched the intro video before beginning this video module. If you have not yet watched the intro video, which explains how to proceed through the course and how to obtain all the steps of certification, please stop this module and watch the intro video. The curriculum for the NRCME exam mandates that we discuss a history of the FMCSA, its organizational structure, and introduce you to the job of commercial driving. The U.S. Department of Transportation regulates interstate commerce. The Motor Carrier Safety Improvement Act of 1999 created the Federal Motor Carrier Safety Administration by moving the Office of Motor Carriers from the Federal Highway Administration to become the FMCSA. The FMCSA is one of 9 administrations in the Department of Transportation. The FMCSA activities contribute to ensuring safety in motor carrier operations through strong enforcement of safety regulations, targeting high-risk carriers and commercial motor vehicle drivers, improving safety information systems and commercial motor vehicle technologies, strengthening commercial motor vehicle equipment and operating standards, increasing safety awareness. The FMCSA mission statement. The Federal Motor Carrier Safety Administration is focused on reducing crashes, injuries, and fatalities involving large trucks and buses. In carrying out its safety mandate to reduce crashes, injuries, and fatalities involving large trucks and buses, the FMCSA develops and enforces data-driven regulations that balance motor carrier safety with industry efficiency, harnesses safety information systems to focus on higher-risk carriers in enforcing safety regulations, targets educational messages to carriers, commercial drivers, and the public, partners with stakeholders including federal, state, and local enforcement agencies, the motor carrier industry, safety groups, and organized labor on efforts to reduce bus and truck-related crashes. The FMCSA Office of Medical Programs is the lead federal agency within the FMCSA for the regulation of commercial motor vehicle drivers' health and safety. The Office of Medical Programs mission statement: to promote the safety of America's roadways through the promulgation and implementation of medical regulations, guidelines, and policies that ensure commercial motor vehicle drivers engaged in interstate commerce are physically qualified to do so. To promote safety, the Office of Medical Programs oversees the national medical certification process for commercial motor vehicle drivers who operate in interstate commerce, develops and implements medical regulations, policies, and procedures, oversees and supports the Medical Review Board in accordance with the Federal Advisory Committee Act, develops and implements the National Registry Program, a national medical examiner system, and a linked national driver medical reporting system, conducts and oversees the agency's medical exemption and certificate programs, serves as the lead federal agency for the regulation of commercial motor vehicle driver health and safety, and conducts relevant medical research. The proximate cause leading to the requirement for commercial motor vehicle driver certification was the 1999 bus crash in New Orleans on Mother's Day. In this crash, 22 passengers were killed and 15 passengers and the driver suffered serious injuries. The National Transportation Safety Board investigated this crash and reached several conclusions. The NTSB stated that the driver should not have been medically certified because he had several disqualifying medical conditions, including renal failure and heart failure. The NTSB concluded that the failure to prevent this driver from being medically certified was not an isolated case. It was part of a systemic failure of the medical certification process to detect and remove medically unqualified drivers from service. On April 10, 2012, the FMCSA established a national registry of certified medical examiners. As of May 14, 2014, only these certified medical examiners are able to legally certify commercial motor vehicle drivers. The NRCME mission statement. The primary mission of the National Registry of Certified Medical Examiners is to improve highway safety by producing trained, certified medical examiners who can effectively determine if a commercial motor vehicle driver's health meets FMCSA standards. Certified medical examiners demonstrate an understanding of FMCSA physical qualification requirements and the demands of commercial driving, driver tasks, and the work environment. Examiners perform driver certification examinations in accordance with FMCSA physical qualification requirements and medical guidelines. The FMCSA regulations identify a person who can be a medical examiner by two criteria: professional licensure and scope of practice that includes performing physical examinations. Medical examiner means a person who is licensed, certified, and/or registered in accordance with applicable state laws and regulations to perform physical examination. The term includes, but is not limited to, doctors of medicine and osteopathy, advanced practice nurses, physician assistants, and chiropractors. The FMCSA Office of Analysis, Research, and Technology provides the transportation industry and the public with analytical reports on trends, costs, fatalities, and injuries in large truck and bus crashes. ART research and data help identify factors that contribute to crashes. The FMCSA uses this information to develop effective countermeasures that will reduce the occurrence and severity of crashes. The ART prepares all economic and environmental analyses for FMCSA rulemakings to ensure that changes to motor carrier regulations are based on sound data and analysis. The Code of Federal Regulations is divided into 50 titles. These are broad areas subject to federal regulation. The Federal Motor Carrier Safety Regulations are the legal requirements for interstate commercial vehicles, drivers, and motor carriers. You will see the abbreviation FMCSR frequently. The Code of Federal Regulations is divided into 50 titles, and Title 49 is Transportation. Chapter 3 of Title 49 is Federal Motor Carrier Safety Administration, Department of Transportation. Part 391 describes the qualification of drivers. This is then subdivided into sections. So, Regulation 49 CFR 391.41 describes the commercial motor vehicle driver physical qualifications. This regulation outlines 13 standards for medical certification of the driver, that is, 13 criteria that are used to determine the driver's medical fitness for duty in order to be certified to drive a commercial motor vehicle. The bulk of this course will be spent reviewing these criteria. However, at this juncture, it is important to understand the difference between those standards that are discretionary and those that are not, meaning that as the medical examiner, you have no discretion to deviate from the published regulation. There are now 3 criteria that are non-discretionary: hearing, vision, and epilepsy. This means that the driver must meet the hearing and vision criteria in order to be certified to drive and cannot have a diagnosis of epilepsy. For years, use of insulin was disqualifying, and this was non-discretionary. If a diabetic driver used insulin, this was disqualifying. The only way a driver treated with insulin could be allowed to drive was with a federal diabetes exemption waiver. However, effective November of 2018, new FMCSA regulation allows medical examiners to certify drivers with insulin-treated diabetes. This will be discussed in detail. The remaining FMCSA criteria are guidance. These guidelines are based on expert review and considered best practice. They are not legally binding, but can be considered the standard of care. The examiner may choose to deviate from these recommended guidelines, but the reasons for not allowing the medical guidelines should be documented. There are several other regulations that are pertinent to the medical examiner. Regulation 49 CFR 391.43 describes the responsibilities of the medical examiner, including general instructions for performing the medical examination, a description of driver tasks and work environment, medical advisory criteria, the sample medical examination report form, and the medical examiner's certificate. Regulation 49 CFR 391.45 identifies who must have the commercial motor vehicle driver physical examination. Regulation 49 CFR 391.47 describes the process for conflict resolution when there is a disagreement between the primary care provider for the driver and the medical examiner for the motor carrier concerning driver qualifications. Regulation 49 CFR 391.49 describes the Skill Performance Evaluation Certification Program. This program will be discussed in detail later in this course. Its purpose is to allow some drivers who are unable to meet the medical standards because of loss or impairment of an extremity to obtain a waiver to drive a commercial motor vehicle. 49 CFR 391-64 describes grandfathering for drivers who participated in vision and diabetes waiver study programs. 49 CFR 40 describes regulations for medical review officers and substance abuse professionals, including drug and alcohol testing procedures. As discussed, the FMCSA provides guidance regarding the medical standards drivers must meet in order to be qualified to drive a commercial motor vehicle. The FMCSA has a process to review and update regulations and guidelines. The agency conducts expert analyses from federal data and other relevant international, national, and state data. The FMCSA then formulates questions related to specific medical conditions and their impact on driving safely. A report is developed that contains a systematic review of the evidence-based scientific literature that reflects current diagnostic and therapeutic medical advances. A medical expert panel is appointed that is composed of subject matter experts in a particular area. The panel reviews the evidence report and issues their recommendations to the FMCSA for certifying commercial motor vehicle drivers with specific conditions. So, for example, if the FMCSA is interested in reviewing and possibly updating its guidance regarding drivers with a history of cardiovascular disease, it will convene a medical expert panel consisting of prominent cardiologists. The Medical Review Board was established in accordance with the Federal Advisory Committee Act. It meets 3 to 4 times each year to review and discuss specific topics. The Medical Review Board independently reviews the evidence report, the medical expert panel opinion, and related information. The Medical Review Board proposes its recommendations to the FMCSA. In deciding guidelines to be used, the FMCSA considers the evidence reports, medical expert panel opinion, the Medical Review Board recommendations, feasibility, the economic impact on carriers and drivers, and the legal implications. Now let's review some important definitions. Commercial motor vehicle means any self-propelled or towed motor vehicle used on a highway in interstate commerce to transport passengers or property when the vehicle has a combined gross vehicle weight or weight rating of greater than or equal to 10,001 pounds, is designed or used to transport greater than 8 passengers, including the driver, for compensation, is designed or used to transport greater than 15 passengers, including the driver, whether for compensation or not, transports hazardous materials in quantities that require placards under the hazardous materials regulations. It is not uncommon to find questions regarding the definition of a commercial motor vehicle to appear on the NRCME exam. A driver means any person who operates a commercial motor vehicle. Interstate commerce means trade, traffic, or transportation between a place in a state and a place outside of such state, including a place outside of the United States, between 2 places in a state, through another state, or a place outside of the United States, or between 2 places in a state as part of trade, traffic, or transportation originating or terminating outside the state or the United States. Intrastate commerce means any trade, traffic, or transportation in any state which is not described in the term interstate commerce, as previously explained. Medical examiner means a person who is licensed, certified, and/or registered in accordance with applicable state laws and regulations to perform physical examinations. The term includes, but is not limited to, doctors of medicine and osteopathy, advanced practice nurses, physician assistants, and chiropractors. A motor carrier means a for-hire motor carrier or a private motor carrier. The term includes a motor carrier's agents, officers, and representatives, as well as employees responsible for the hiring, supervising, training, assigning, or dispatching of drivers and employees concerned with the installation, inspection, and maintenance of motor vehicle equipment and accessories. This definition includes the terms employer and exempt motor carrier. As mentioned, Regulation 49 CFR 40 outlines the regulations for medical review officers and drug and alcohol testing procedures. The Omnibus Transportation Employee Testing Act of 1991 requires drug and alcohol testing of safety-sensitive transportation employees in aviation, trucking, railroads, mass transit, pipelines, and other transportation duties. The DOT publishes rules on who must conduct drug and alcohol tests, how to conduct those tests, and what procedures to use when testing. There are times when a medical examiner may have interactions with healthcare professionals who perform services in the drug and alcohol testing program. A medical review officer is a person who is a licensed physician and who is responsible for receiving and reviewing laboratory results generated by an employer drug testing program and evaluating medical explanations for certain drug test results. A substance abuse professional is a person who evaluates employees who have violated DOT drug and alcohol regulations and makes recommendations concerning education, treatment, follow-up testing, and aftercare. The next section of this module will familiarize you with the job of commercial driving. The FMCSA regulates interstate commercial operations, including the drivers, the trucks and buses the drivers operate, the motor carrier, and the transportation of hazardous materials in a quantity requiring placards. A safety risk in any one or more of these commercial operation components can endanger the safety and health of the public. Approximately 6 to 7 million commercial motor vehicle drivers are required by law to comply with FMCSA physical qualification standards. Thus, an estimated 3 to 4 million physical examinations must be performed annually, with the demand increasing every year. In addition to medical fitness for duty certification, other regulations affecting the commercial motor vehicle driver include drug and alcohol testing, record keeping, and hours of service. Motor carriers, both for hire and private, must comply with FMCSA regulations governing their drivers and minimum levels of financial responsibility. In the Federal Motor Carrier Safety Regulations, the term motor carrier refers to agents for motor carriers, officers, representatives, employees responsible for the hiring, supervising, training, assigning, and dispatching of drivers, employees concerned with the installation, inspection, and maintenance of motor vehicle equipment and accessories, the employer, and exempt motor carriers. Motor carriers are responsible for ensuring that the driver meets the general qualification requirements of Regulation 49 CFR 391.11. The driver must be at least 21 years old, speak and read English well enough to converse with the general public, understand highway and traffic signals, and respond to official questions. The driver must make legible entries on reports, be capable of safely operating the commercial motor vehicle. The driver must have a current medical examiner certificate on file, have only one valid commercial motor vehicle operator's license, have provided the motor carrier with required background and violations information, not be subject to disqualification to drive a commercial motor vehicle under the rules in Regulation 49 CFR 391.15. This regulation stipulates the reasons for disqualification of drivers, and the driver must have successfully completed a driver's road test or equivalent. Commercial driver medical fitness for duty records must include all federal physical qualification requirements found on the medical examination report form. Truck and bus companies may also have additional medical requirements, such as a minimum lifting capability. The driver could fail a motor carrier pre-employment driver certification examination and still meet the federal physical qualification requirements for certification and issuance of a medical examiner certificate. States regulate interstate commerce and commercial drivers who are not subject to federal regulations. They are required at a minimum to adopt federal physical qualification requirements and may even have additional, different, or more stringent requirements. Medical examiners are responsible for knowing the driver regulations for their state or the states in which they practice. The driver population exhibits characteristics similar to the general population, including an aging workforce. Aging means a higher risk exists for chronic diseases, fixed deficits, gradual or sudden incapacitation, and the likelihood of comorbidity. All of these can interfere with the ability to drive safely, thus endangering the safety and health of the driver and the public. The average truck or bus driver is a male over 40 years of age, is sedentary, overweight, a smoker, and has poor eating habits. The average commercial motor vehicle driver is less healthy than the average person and has more than 2 medical conditions. Cardiovascular disease is prevalent. Many factors contribute to making commercial driving a stressful occupation. Types of routes. Turnaround or short relay routes allow the driver to return home each evening. A long relay route requires driving 9 to 11 hours, followed by at least a 10-hour off-duty period. Several days may elapse before the driver returns home. With a straight-through haul or cross-country route, the driver may spend a month on the road, dispatched from one load to the next. The driver usually sleeps in the truck and returns home for only 4 or 5 days before leaving for another extended period on the road. In team operation, drivers share the driving by alternating 5-hour driving periods with 5-hour rest periods. Schedules. Abrupt schedule changes and rotating work schedules may result in irregular sleep patterns and a driver beginning a trip already fatigued. Tight pickup and delivery schedules require both day and night driving. Failure to meet schedules may result in a financial loss for the driver. Long hours and extended time away from family and friends may result in a lack of social support. Environment. The driver may be exposed to excessive vehicle noise, vibration, and extremes in temperature. The driver may encounter adverse road, weather, and traffic conditions that cause unavoidable delays. Types of cargo. The driver of a bus is responsible for passenger safety. Transporting passengers also demands effective social skills. Loss of or shifting cargo while driving can result in serious accidents. Transporting hazardous materials, including explosives, flammables, and toxics, increases the risk of injury and property damage extending beyond the accident site. The tasks of commercial driving. Staying alert when driving. This demands sustained mental alertness and physical endurance that is not compromised by fatigue or sudden incapacitating symptoms. Required cognitive skills include problem solving, communication, judgment, and appropriate behavior in both normal and emergency situations. Driving requires the ability to judge the maximum speed at which vehicle control can be maintained under changing traffic, road, and weather conditions. Use of side mirrors. Mirrors on both sides of the vehicle are used to monitor traffic that can move into the blind spot of the driver. Mirrors are also used in backing up trucks to loading and unloading areas. Sufficient lateral cervical mobility is needed for effective use of side mirrors. Control of the steering wheel. Steering wheels of large trucks and buses are oversized. The act of steering can be simulated by offering resistance while having the driver imitate the motion pattern necessary to turn a 24-inch steering wheel. Manipulation of dashboard switches and controls. Large trucks and buses are complex vehicles with multiple dashboards, switches, and knobs. Use of these components requires adequate reach, prehension, and touch sensation in hands and fingers. Shifting gears. The manual transmission of a large truck may have more than 20 gears. This requires the driver to repeatedly perform reciprocal movements of both legs coordinated with right arm and hand movements. Entering and exiting the vehicle. The driver may have to enter and exit the vehicle similar to the way an individual climbs a ladder, by maintaining 3 points of contact for safety. Full overhead extension may be required to reach the handholds. Hip angle and knee flexion may both have to exceed 90 degrees. Coupling and uncoupling the trailers. Multiple subtasks are performed in the process of coupling and uncoupling the trailer, including raising and lowering the trailer supports, connecting air lines and electrical cables, and checking the height of the trailer kingpin. Physical demands include grip strength, upper body strength, range of motion, balance, and flexibility. Load, secure, and unload cargo. The FMCSA guidelines do not specify the number of pounds a driver must be able to lift. However, the CDC table of general physical activities defined by level of intensity lists loading and unloading a truck as an example of a vigorous activity that requires the individual to exert greater than 6 metabolic equivalents in performance of the activity. Perform vehicle checks. Grip strength, upper and lower body strength, range of motion, balance, and flexibility are required to inspect the engine, brakes, and cargo. Vision and hearing are used to identify and interpret changes in vehicle performance. The FMCSA is dedicated to lowering the rate of crashes, injuries, and fatalities involving large trucks and buses. When a fatal crash involves at least one truck, regardless of the cause, the occupants of passenger vehicles are more likely to sustain serious injury or die than the occupants of a large truck. Why are the death rates of occupants in passenger vehicles so high? The answer is found in basic physics. Injury severity equals relative velocity change. The greater the mass, the less relative velocity change. The crash of a vehicle having twice the mass with a lighter vehicle equals a 6-fold risk of death to persons in the lighter vehicle. A sport utility vehicle weighs approximately 4,000 pounds. A loaded semi-truck weighs roughly 80,000 pounds. The truck has 20 times the mass of the SUV. Considering the high rate of illness in the commercial driver population, the examiner needs to consider the safety implications of any existing disease process or the treatments of those conditions and the effect on the ability to perform the job of driving. A physical condition may be disqualifying because the symptoms, even if medically benign, interfere with the ability to drive. An example would be supraventricular tachycardia, often a benign diagnosis, but not when it results in near syncope in a commercial motor vehicle driver. The onset of symptoms may be so fast that the driver may be unable to stop the vehicle safely before becoming incapacitated. The onset of symptoms may be so gradual that the driver is unaware of diminished ability to operate a commercial motor vehicle safely. Consider if the presence of a mental or physiological condition is disqualifying because it interferes with cognitive abilities used to process environmental cues rapidly and make appropriate responses, problem-solving skills used to function independently of direct supervision in a new environment or in the event of an emergency, behavioral inhibitors that suppress inappropriate, irresponsible, or possibly violent actions. Consider, is the use of a medical treatment qualifying because it controls a physical or mental condition allowing the driver to perform tasks more safely than without the treatment? Disqualifying because the effects, even if medically optimal, interfere with safe driving? Disqualifying because the side effects interfere with safe driving. This concludes Module 1.